My name is Teresa McKinney. I am a patient at the Breast Center at the University of Chicago. What brought me to the University of Chicago Breast Center is that I went to my doctor and had a battery of tests done. The results were very unfavorable. My husband at that time went to a co-worker at his job. They discussed it. He recommended the University of Chicago. He came home, we talked about it, we called the University of Chicago, and the very next week I got an appointment, and that's what brought me to the University of Chicago. So I felt comfortable working with the staff at the University of Chicago Breast Center because it was a group of women, and they were very compassionate and understanding, and they made me feel very at ease. I had a lumpectomy, and it was performed by Dr. Jaskowiak at the University of Chicago. The team prepared me for the surgery by sitting me down, explaining it to me. The doctor ordered a battery of tests for me, which made me feel very, very comfortable. So instead of getting one opinion or two, I got a team opinion of what was going on with my diagnosis, and that made me extremely comfortable. The follow-up care was very, very comfortable. They called me quite a bit at home. They talked to my husband, my son, any family member, and I could always call them and ask them any type of questions that I needed an answer for, because I was very afraid, but they made me feel very comfortable. I feel that the clinical staff understood my needs and concerns by always asking me to make sure that I felt okay, that I understood every treatment that I was going through. Some of the staff, excuse me, the doctors and the nurses who had breast cancer let me know that they had breast cancer, and that made me feel very, very comfortable. Whenever I would come in for an examination or a checkup, they were always concerned about how I was feeling, how I was doing, how was the chemo working, and the point that I had a surgeon who did my surgery that still saw me every 6 months and still seeing me to today let me know just how much they really were concerned about my well-being. And the nurses would call me sometimes at home on the weekend to make sure that I was feeling okay. I chose the best place for my care because I'm still here for one, the collaboration with the doctors and the staff for another. And it was just a very good experience for me to know that I had a group of doctors working to save my life, and that made me feel very good. I would recommend it because when you go to the doctor to get a diagnosis for any kind of illness, you always want a second opinion. At the University of Chicago, you get several opinions, but all of the opinions are collaborated just to help you. So you have a group of doctors working for you with just one diagnosis, and that's a very good feeling. So I would recommend University of Chicago to anyone that wants treatment and wants to survive. I would recommend the University of Chicago to them. By coming to the University of Chicago, the very first thing that I would want to hear of any patient is that you caught it early enough, that you're going to survive it. With the love of your family and your faith, you will get through it. And 4.5 years later, I'm still here. There's hope. It's not a death sentence at all.